The AP projection of the foot is actually an AP axial projection because there's angling of the central ray 10 degrees posteriorly to the IR. When the 10-degree posterior angle is used, the central ray is perpendicular to the metatarsals, which reduces foreshortening. Additionally, the TMT joint spaces of the midfoot are also demonstrated better. For this, place the patient in a supine or seated position. Then, flex the knee of the affected side enough to rest the sole of the foot firmly on the radiographic table. Once the foot is centered to the IR, direct the central ray 10 degrees toward the heel, entering at the base of the third metatarsal. Collimation should have 1 inch on each side, and be sure to include light field beyond the calcaneus and the distal tip of the toes. Once an exposure is made, the following image should be presented. Here there is evidence of proper collimation. Notice there is no rotation of the foot, and there is also overlap of the 2nd through 5th metatarsal bases. Additionally, open joint spaces between the medial and intermediate cuneiform should be visualized. You are now ready to position the patient for an AP oblique projection and medial rotation. The medial oblique is preferred over the lateral oblique because the plane through the metatarsals is more parallel to the IR, and it also opens the lateral side joints of the midfoot and hindfoot better. For this position, simply rotate the patient's leg medially until the plantar surface of the foot forms an angle of 30 degrees to the plane of the IR. If the angle of the foot is increased more than 30 degrees, lateral cuneiform tends to be thrown over the other cuneiform bones. In some instances, an angulation of only 15 to 20 degrees is sufficient for a medial oblique projection. Once positioned properly, direct the central ray perpendicular to the base of the third metatarsal. Collimation should be similar to that of the AP. When evaluating your image, of course there should be evidence of proper collimation. However, the 3rd through the 5th metatarsal bases are now free of superimposition. Additionally, the bases of the 1st and 2nd metatarsals should be superimposed on the medial and intermediate cuneiforms. Also, one note I'd like to make is that the entire calcaneus bone should be visualized on the image as well, unlike in this image seen here. You are now ready to perform the lateral projection of the foot. The lateral or medial lateral projection of the foot is routinely used in most radiology departments because it is the most comfortable position for the patient to assume. Here, you have the patient lie on the radiographic table and turn toward the affected side until the leg and the foot are true lateral. Adjust the foot to place the plantar surface of the forefoot perpendicular to the IR, as seen here. Be sure to dorsiflex the foot to form a 90-degree angle with the lower leg. The central ray should be directed perpendicular to the base of the third metatarsal. Collimation should include 1 inch on all sides of the shadow of the foot, including 1 inch above the medial malleolus. The resulting image should show the entire foot in profile, the ankle joint, and the distal ends of the tibia and fibula. Additionally, the metatarsals should be nearly superimposed. The fibula should be overlapping the tibia, and the tibio-talar joint should be well visualized. You are now prepared to complete a foot series.